Good afternoon. My name is Amanda Spielman. Thank you for the opportunity to present. To provide some background and define fibrosis, tissue fibrosis is the deposition of excessive extracellular matrix and can occur as part of the body's natural wound healing process upon injury. The fibrotic response occurs when connective tissue or collagen replaces normal parenchyma, as opposed to regeneration, which occurs when damaged cells are replaced by the same cell type. When uncontrolled, fibrosis can lead to end-stage disease, such as IPF and scleroderma. Fibrosis occurs in virtually every tissue type. Of particular interest to our team is what occurs during muscle fibrosis, defined here as the disruption of structural and functional skeletal muscle with extracellular matrix. Muscle fibrosis is seen in aging as well as disease states such as muscular dystrophies and neurodegenerative disorders. We don't know what causes the muscle to become fibrotic, and we don't know what cell populations are responsible. We also have no way to prevent or rescue muscle fibrosis. In reconstructive plastic surgery, muscle fibrosis is especially important due to the wide use of vascularized muscle flaps and the need for muscle flap preservation. As volume changes occur over time, we may lose form and function. One area of study is denervation in muscle fibrosis, as it leads to myofiber atrophy, fibrosis, and fatty tissue infiltration. Our lab is focused on wound healing, minimizing fibrosis, and promoting regeneration. By creating a model to study fibrosis, our team can better understand what is occurring to cause muscle fibrosis and how we can prevent muscle flap compromise moving forward. Our aims for this project are to create a murine model that induces muscle fibrosis that is reproducible so we can study it. And having created a model, we then want to identify the cell populations responsible. So how did we do this? We looked in the literature and found that there's a very common model of crush injury, and nerve injuries were also described. We wanted to compare these models to determine if the same cell populations were present after tissue injury. We wanted to first show you the model in more details. Here we show the gross images in figure 1. And ultimately, our aim was to determine if a sciatic nerve injury produced the same results as the crush injury. So we targeted the tibialis anterior muscle, and we left these models out to post-op day 14. We can see in figure 2 that the model worked. Fibrosis in the muscle was clear in the density of the collagen. And more interesting to us, we saw that there was a presence of adipocytes at the site of injury. To confirm that these were adipocytes and it contributing to muscle fibrosis, we performed IHC. We found that the infiltrating cells were adiponectin positive and COL1 positive, shown in figure 3. This brings us to aim 2, where our goal was to identify which cell populations contributed to muscle fibrosis, and we did so by using constitutive genetic lineage tracing of mature adipocytes to track adipocytes' response to injury. Lineage tracing is a way of identifying cells that express a certain protein using fluorescent labeling. And so we used a transgenic mouse with an adipocrete driver and an MTMG reporter to label any cell that had expressed adiponectin, a marker of mature adipocytes in our injury models. This allowed us to identify wound fibroblasts that arose from adipocytes. In addition to these methods, we repeated the AIM-1 model and also performed FACS analysis on our harvested tissue. We observed significantly greater number of GFP positive cells, shown in figure 4, and infiltrating GFP cells were upregulating fibrotic markers such as collagen 1, which is stained for here. So what are our conclusions? We were able to successfully create muscle fibrosis using established approaches. We also determined that adipocytes may play a role in muscle fibrosis, and we were able to use lineage tracing to track their behavior as they infiltrated into the wounded muscle. So now, going forward, we can begin to examine how to intervene to prevent muscle fibrosis from occurring. First of all, there seems to be an important communication between nerve cells and adipocytes, which we saw after our sciatic nerve injury model. We want to be able to better understand this crosstalk. One way to intervene would be to prevent adipocytes from migrating over after nerve injury, causing fibrosis. Second, we could combine an anti-adipocyte migratory factor with a nerve growth factor to promote innervation and prevent or rescue fibrosis. Thank you for the opportunity, and here are my references.